Thank you everyone so much for joining. My name is Kalina Quabell. I'll be kind of emceeing the session today. Really appreciate all of you joining. This is a topic I care a lot about as a woman, as a mom, as someone who's kind of, been past the first part of my family forming journey, but knows in the years ahead that there's a lot to continue by way of women's health. And so for those of you who joined, the topic of today will be Beyond Fertility, the next frontier of women's health. What we're really going to be focusing on is not just a lot of the common topics you hear about as it relates to women's health in the workplace, like fertility solutions, but really diving into some of these other areas like thyroid care, menstrual health, and menopausal support. A few statistics I wanted to read you just to show kind of the dire importance of this topic that I found really interesting. So as it relates to thyroid disease, 1 in 8 women will have a thyroid issue in her lifetime. That means 20 plus million Americans right now are actually diagnosed with an underactive thyroid or hyperthyroidism. Women are also about 5 to 8 times more likely than men to develop thyroid problems. And then as it relates to menopause, this is really interesting. And for any of you that read LinkedIn's 41 predictions for last year, menopause was one of those. It's going to be a big thing because 1 in 3 workers will be over the age 50 by 2030, which means that the number of women in the workplace with menopause issues is set to rise. Over 2/3 of women who have menopause have trouble concentrating at work, and over 30% took sick leave to manage their symptoms, while worse, 1/3 felt too embarrassed to raise that issue with their manager. And then lastly, on the gynecology side of things, women with complex chronic issues are also something employers need to care about because the cost is about 2 to 3 times the average. They're 3 to 7 times more likely to have surgery, and 2 to 3 times more likely to visit the emergency departments, and 2 times more likely to use behavioral medications, which can be costly and also detrimental to women themselves. So with that, I'm going to pass it over to our amazing panelists. They're going to tell you a little bit about what each of them and their companies do. So joining us today, we have Marina Tarasova, co-founder and COO of Paloma Health, which focuses on virtual thyroid care. We have Shelly Lanning, who's the co-founder and president of Visana Health, which is a virtual gynecology clinic. And then Alessandra Henderson, co-founder and CEO of Electra Health, which focuses on menopausal care. So with that, I'll pass it off to them, let the experts talk a little bit about what they do, and then we'll go ahead and come back together and dive into some of these questions. So go ahead.
Perfect. So I think this is over to me. So hi, everyone. I'm Alessandra, the co-founder and CEO of Electra. First of all, thank you so much to the Paloma team for organizing this and bringing everyone together. This is such an important topic that, not only is coming, thankfully, into the more public conversation, but is something that everyone around this virtual table I know thinks very dearly about, and we're just excited to continue the momentum in the women's health space into 2023 and beyond. So a little bit about, as we mentioned, Electra focuses on helping women navigating menopause. You can think of menopause as everything post-fertility, right? The topic of this conversation is beyond fertility, and that's really what the Electra solution is here for. I'll walk through a little bit of how we help women navigating menopause, especially those in the workforce, but just a couple of additional statistics that I think are really important here. So first of all, for those of you who are employers who are thinking about supporting women navigating menopause, we did do a study last year that 1 in 5 women in the US have left their job or have considered leaving their job due to menopause. That is a massive number of women. Furthermore, this is especially pronounced for Black women. So in our report that we came out earlier this year, about 24% of women, Black women, I should say, reported that they were not pursuing promotions due to their menopause symptoms. So if you have been doing your great diligence around building an inclusive culture, building thinking about how you get more senior women in management positions, this is a topic you just simply cannot ignore. And we're really excited to kind of offer a solution around that. So at Electra, our 3 core pillars are care, content, and community. And how that really translates is we have built a digital platform that supports women over the 365 days of the year. The members on our platform are paired one-on-one with, we call them Electra guides, but you can think of them like menopause doulas. They are registered nurses who are coached up in Electra's proprietary menopause care model and approach. And women work one-on-one with those doulas in an unlimited way to build out personalized care plans and really start tackling symptoms. We then have about 100 hours of evidence-based education to help supplement that, as well as a supportive community. And this community aspect is incredibly important, especially as many of our workers are sitting at home alone and feeling very, very lonely with their experience. Electra builds out kind of a digital safe space where women can come together, ask questions, and be supported by one another. So in my final piece on Electra, we have started working with employers as well as health plans as our initial partners. So we've launched with Mass General Brigham Health Plan earlier this year, and we'll be launching with Emblem Health in January. As we move to 2023 and beyond, we're excited to continue to expand the number of folks that we're working with to reach members in your communities.
Amazing. All right, we'll go up next. Oh, you're on mute, Marina.
Oh, thanks so much. Thanks, Alessandra. I'm just really delighted to be having this conversation with you all. And we're so excited about the interest in the conversation too, which means folks out there, all of you are doing your jobs right on sort of furthering the conversation around women's health in the workplace. And when we have the conversation around women's health, it's really imperative that we include thyroid health as one of those things. It may not be the first thing that comes to your mind, but hopefully I'll be able to share some important stats on why it should be. About 12 to 20% of women will have a thyroid issue, either pronounced or just an autoimmune attack that's attacking their thyroid that might raise the risk of further thyroid issues in their lifetime. And the main thing that happens with a thyroid is it becomes underactive, leading to things like fatigue and weight issues and a whole host of symptoms that are really not optimal for a woman, any woman, but also really not optimal to have in the workplace. The drug used to treat underactive thyroid is actually the #1 most prescribed drug in the US, so it's incredibly prevalent. And the 20 million Americans that take that drug happen to be mostly women between the ages of 30 and 50, so in the workforce. And for a number of structural reasons in healthcare today, which we won't go into, only 6% of patients are really satisfied with their care. And so we're not doing enough for these patients, largely women, and that's really why we started Paloma Health. So next slide, if we may. The reason I co-founded Paloma Health was out of working in the thyroid space and seeing how the care in the thyroid space had to be extremely nuanced and personalized, and how many people were not getting that care today in the status quo. So what we built was the first virtual clinic. We're effectively a doctor's office that sees patients from the comfort of home. We see patients, we have prescribed medications, we provide the ability for people to test and monitor their thyroid function from home. And we also use holistic interventions, so lifestyle and nutritional approaches to help improve the autoimmunity that's going on inside one's body and to improve the symptoms, which are really prevalent in these set of conditions. So we're really excited to be doing this. We've heard from many patients that we've changed their lives for the better and improved their symptoms, mainly fatigue and weight issues, in a tremendous way. And we're also really proud of the fact that we accept most of the major insurance carriers. So as we're having conversations with employers, we're able to plug into the solution that they already have and their employees might already have access to, but may not know. So we're excited to put thyroid health on the map and to have further this conversation in 2023 and beyond.
Amazing. And that last but not least, Shelly.
All right, Shelly Lanning, very nice to meet you all. Before I get started, I'll say a little bit that I've spent the last 22 years as a healthcare venture capitalist, investing in a wide array of digital and then women's health conditions. And it started as a natural fetal maternal medicine, fertility, and as I moved beyond my family building years, it became quite evident to me that there was so much that extends beyond family building that primarily goes ignored in the market. If you were to move to the next slide, we'll take a look at a little bit of what we're seeing out there, but 90% of all women have concerns with their health that extend beyond family building, which is a really small sliver of their reproductive years. 73% of those women don't think they get adequate care. Either they live too far from care, they don't have access to a highly trained OBGYN, or they might wait months and months in order to get an appointment. 45% of all women, this is a really big number, end up with at least one gynecology surgery by the time she's 45 years old. Those can be laparoscopies and hysterectomies. But hysterectomies end up costing the system a huge amount of money in that they are around $20,000 a pop, and 75% of them or more are deemed unnecessary. So this is a really big area of focus. It's a top 5 cost driver, and employers are starting, especially in the last few years, to focus quite heavily on them. So next slide, please. At Visana, we define women's health as everything outside of family building. And we have 3 primary drivers to our value proposition. We are comprehensive, we are whole person, and we are coordinated. And we believe really strongly in these 3 value drivers. From a comprehensive perspective, we treat dozens of health conditions for women that range from menstruation to menopause. Our pillar, where we started our bread and butter, is in complex gynecology. We look at endometriosis, uterine fibroids, chronic pelvic pain, heavy menstrual bleeding. These are the conditions that last a woman for many, many years, difficult to understand that and to get treatment for, and cost the system a lot of money in unwanted emergency room visits and also in unnecessary surgeries. So we treat conditions from the simple to the complex, for birth control to UTIs, breast health, all the way through the complex conditions. We believe in whole person care, which for us allows a team of clinicians with heavily trained OBGYNs, nurse practitioners, care coordinators, and health coaches. They work together to provide long appointment times, time on task throughout unlimited visits, access to diet, health, nutrition, cognitive behavioral therapy, mental health support. Because their woman's care is tied to her hormonal cycle or menstrual cycle, it's very iterative. It depends on what point in the month you are, where she's in her cycle, what's happening with her. So to be able to have clinical care, access to prescriptions, diagnostics, labs, and whole person care allows for the patient to receive the care she needs when she needs it. And last but not least, we know that all care cannot be provided virtually, and women need to be seen in person. And we provide excellent coordinated care. We partner with health plans and with self-funded employers to identify high quality, low cost, in-network providers. We help that woman to get an appointment, to transition medical records. We make sure that they have the IUDs in stock and can provide appointment times in a short time period. So we help that woman get there, get her care, and then we follow and track it as we go along as well. So comprehensive whole person and coordinated care is our largest value proposition.
Amazing. Thank you. Thank you. So throughout the panel, we'll obviously touch on a little bit more of these, but really the primary focus is to talk about, the expertise in this topic in general and why it's important. With that said, I think a natural question we can start with, which actually came from the audience, is related to kind of the rise in femtech funding and how many solutions there are out there. So I wanted to point it toward you, and maybe Marina, you can start with this one, but there are so many point solutions out there to the point of fatigue for many employers and employees, and it can be confusing. So why should employers continue to focus on access to women's health solutions? And then kind of as a tag on to that, how do maybe your products cut through the other noise of what else is out there in terms of how employers spend their money?
Yeah, absolutely. And awesome question. That really is the heart of, like, I think how the digital health ecosystem is shaping out. The reality is that healthcare, especially women's healthcare, can be complex and nuanced, and no one solution could nor should really do it all. Medical specialization has been around since like the Roman Empire, and really kind of honed itself to the system that we know today in the 19th century. So it's important to consider that when you're offering a comprehensive set of benefits to your employees, if you're thinking about it, that specialized solutions that know how to work within the rest of the ecosystem for your population and engage in them can actually be a really amazing way to offer care. And to people are always going to get specialized care, in the market, and they're going to go in network or out of network. And if it's offered in an unintegrated way, it's actually going to drive more cost. And it's largely going to be fee for service when folks just go out and, the insurance directory, and it's going to continue to drive costs up further. So as one is thinking about, including, if you believe that specialized solutions, especially for women's health, are important, it actually makes sense that it's integrated well within your offering. And when you think about sort of specialized, or I don't love the word point solutions, but if we think about them, they actually tend to really engage employees really well and see much better outcomes. So it's really, I think an important aspect for benefits leaders to think about. I also do recognize how much benefits leaders and HR leaders out there have so much to manage, and they're continually asked to do more and more, and think about, fertility and menopause and just healthcare benefits in general, and all the other performance things that they do. So there is a lot on their plate. So as far as at least the solutions here on this call, we're very sensitive to the fact that it's a lot to manage for these folks. And at least if you're interested in these types of specialty solutions that we'll be talking about today, the companies here are happy to go and offer things in a bundled fashion, at least to take some of the administrative burden off of the plate of these folks. But as far as having specialization, I guess one of the messages that I want to have across is that it's ever important. It's going to continue to be important in medicine, and as digital health evolves, it's just sort of the natural evolution of these types of companies.
Yeah, absolutely. And Alessandra, anything you wanted to add there? I saw you nodding a bit.
Yeah, I think, everything Marina said and more, I think that will probably be a theme throughout this webinar. I don't mean to speak for Shelly, Marina, but, we all have somewhat similar viewpoints as to just how much opportunity and how much room there is for growth in the women's health space. I think just kind of stepping back a bit, as we think about women's health, what I would say is kind of historically, or especially as we've thought about bringing women's health benefits into the workplace, we have almost made women's health synonymous with reproductive health. And that's, we know that pregnancies, especially high-risk pregnancies or NICU visits, we know we have that data in hand to really point to the high cost to employers. We need more fertility support. We need more reproductive care in the workplace. We're still just getting started there, and there's room for growth. But I think what we're trying to do here is really make sure that we're building, again, that very inclusive culture where we have not just equated women's health with reproductive health, but are being comprehensive and thinking about all of your employees across a spectrum. In this study, which I'll probably reference several times, we asked women between the ages of 40 to 55 what they think about their current women's health benefits. And we found that about 56% of those women reported that they felt that their women, quote, women's health benefits were lacking around menopause support, or they actually felt excluded. About a third of women felt excluded from women's health benefits. And so what we are doing here, especially at Electra, and I think as a group coming together, is saying that it is critically important that we support the senior women in management to stay in the workplace and to stay productive, continue to think about retention and really invest on that front. So, as to Marina's point, we understand the point solution fatigue. But if we're only rolling out a benefit that is going to, let's say 50% of your workforce is a female, and you're only rolling out a benefit that's going to apply to a small percentage of that population at any one time, we just really haven't gone as far as we can. And then we really need to invest in that. So, I would encourage you to think about women's health as just that expansion of, and really start to think through, what do the various employees in your organization need, even if it's not as immediately obvious as pregnancy or fertility at any one time.
Yeah, that is such a good point. And Shelly, I'm going to direct this next question at you, just kind of running the wide spectrum of things. But I think so many good points brought up. And just to expand on what you just said, Alessandra, about how we've kind of made women's health synonymous with family forming and like fertility, that obviously has been the main thing that a lot of employers have focused on for the past, 5-10 years, is really upping their fertility benefits and all of that. But it's obviously missing a huge segment of the population, people who are beyond their family forming years, but also people that just might not want to form a family and just general women's health. So I'd love to hear from you, Shelly, on just how should employers think about integrating specialty women's care solution into their offerings? Like, what are some of the other aspects to consider that are equally important?
Well, the fact that they're talking about women's health beyond family building at all is such a bonus. And given we sell both health plans and to self-funded employers, we're thrilled to be having so many of these conversations. And I find that they're focused in 4 primary areas, not necessarily in any one order. But first is in the attracting and retaining female talent. Very big focus among a lot of the employers. Number 2, a lot of them talk about wanting to have healthier, more vibrant workforce, and that is engaged members and looking for real clinical outcomes. So they look to close gaps of care. Have you had mammograms? Have you had your flu shot? When is the last time you had your annual exam? We are partnered with a Fortune 200 company going live in January with them, and it is a requirement for them. They care deeply about checking in on breast health and checking in on overall women's health. I believe that they're innovative and a forward thinker, but it gives so much momentum to the space as a whole to see that. Second thing is these employers need you as a company or a partner to make it easy for them. They're always looking for, we have so many solutions. We have so much work. Don't make it more difficult for us. Feed it to them on a silver platter. Go in with marketing collateral. Be really clear about how you can drive it, what your needs, how you can make it easy for them, and without having to have a lot of extra work for them. But a very big one, I'll leave this last, but it's probably first, is financial considerations. So from a employer perspective, budget barriers are extremely real. Have the ability to bill through claims is a game changer in a lot of situations. You shift the location of the expense from the employer, from their budget to their health plan. They don't have to go out and find new dollars. Have utilization-based pricing that allows your member, if they use the plan, they pay for it. If not, they don't. And those are some of the tricks of the trade that a lot of us are making it very easy for the plan. But finally, I think that members really care a lot about the financial considerations as well. We all know that the healthcare system is impossible to navigate, even for those of us who work every day in it. And it often delays care. Women will say, I don't know where to go. I don't know what to do. I got this referral, and now what? So it's super expensive and they don't know what they're getting. So one of the value drivers that we provide at Visana is we provide care navigation. It's core to everything we do. We have the clinicians that can treat them, but then they help them to identify high quality, low cost, in network, and guide the women there. Mammograms are a good example. You can get a prescription and then you go and you don't know if you're paying $800, $1,800, or could it be free? And so we can help guide the women to say, based on your health plan, here's where you can go that's convenient to your work and it doesn't cost you anything, maybe. And so I think that those are some of the core drivers that self-funded employers are looking for us as our solutions to be able to help them to navigate.
Yeah, I think that's great, Shelly. And kind of turning it back over to Alessandra and Marina. I think that that cost, transparency, and also just understanding a lot of these things sometimes live outside of insurance, or at the very least are out of network providers. I'd love to hear about, obviously, women's health has come a long way and women present half the population and there's innovation still needed. So maybe the two of you can speak to some of the imperatives of your solution and basically how the market that those address and how they can help women find those solutions under the cost of your programs versus navigating through the burdens of insurance.
Absolutely. Happy to start here. No, I think Shelly makes a wonderful point that making it very easy for self-insured employers and then the employees themselves get the care that they need through these solutions. So using your insurance card and accessing a solution and making it very easy for the employer to offer it in network is, I think, makes things so much easier when we're working in healthcare in general. When you work within the entrenched systems, it's a much better way to get started, unfortunately. And although it is where we are, it's a very complex system. Who knew? So that's why Paloma Health is offers insurance-based pricing. We're in network. We don't feel that patients should be paying out of pocket for their care, although it does have to happen, and a lot of employers are, going a higher deductible route. So we like to work within the employer setting, within the insurance setting, I should say, and make it really easy for employees to get care. And, making it really easy for employees to know about it. So working with the employer to communicate it and having all the right communication modalities, that's always a challenge, especially when there's so many things that employers have to communicate to employees about, but working really closely with the employer on the communication plan, where in their communications does it make sense to talk about various solutions relating to women's health, et cetera. And then finally, I think as an imperative, we believe that the financial sort of considerations for employers and for payers are probably number one, like Shelly said. So we want to make sure that at the outset of implementing any solution, we have a really clearly focused ROI conversation. What are we going to measure, and what clear metrics are we going to monitor together? And we prefer to use claims data and really just at the end of the day be able to show dollars and cents that a solution like Paloma Health really makes sense and helps to save an employer dollars and a payer ultimately claims dollars, and of course gives a really meaningful care experience and a member experience that's much more superior to what they can get out there in the status quo healthcare system.
Yeah, no, I think looking at women's health again, in the beyond fertility world, right, in the topic of conversation, we have 5, 10, or maybe 10 plus years of some early adopter employers looking at that claims data or the cost again of pregnancy or fertility. What is lacking, and I don't mean to speak for the attendees here today, but in a lot of conversations, we do understand that employers are trying to understand the economic impact of some women's health solutions. I'd be lying if we didn't kind of like put that on the table and say that's a conversation that we have with both health plans and employers who are trying to understand what the cost drivers are in comparison to MSK, cancer, mental health, right? But I think this is the rallying cry where the companies on this call, as well as many other companies, are really starting to put really either clinically validated outcomes or claims data behind it to demonstrate what we all already know, which is that women's health is costing you as an employer, both from the productivity and retention side, but also on the healthcare side. And so, we have the opportunity and the challenge of building the business case to bring to you as employers on why this is the right thing to do, but we know it's there. And so I'll take what I know, the world of what I know quite well, which is menopause or post-fertility experience. And what we're talking about here is not just a quality of life hot flash, although that can impact women's productivity, but we are talking about mental health. So 67% of women report that they're concerned about the impact that menopause has on their mental health. 40% of women experience depression in perimenopause. If you just look at the correlation of menopause to mental health alone, that is a massive driver of what your workforce is experiencing. And take that echoed across 34 symptoms, the complexity of what menopause is. And so, if the conversation only comes down to actuarials, you might not have that data in hand today. But I think it's not only the right thing to do, but we are starting to get, especially at Electra, research studies to build out the case, claims data to build out the case that addressing this population will result in whether it's greater productivity and earnings for your company, or cost savings on the other side, which we know is, especially as we go into 2023, is a massive concern for folks on this call. So we are building that case as we go. And I guess this is the rallying cry to say, believe that the numbers are there, and it's exciting to start to partner and unlock the economic impact of bringing in a women's health solution for your population.
Yeah, I love that. Anything you wanted to add to that, Shelly?
I do. I have a couple of comments around the claims. It's really confusing because so often the women's conditions present differently. So you could be endometriosis affects 10% of the women, but so often is misdiagnosed as a GI or as an autoimmune disease. Uterine fibroids is almost always falls up in the cancer bucket because it's a tumor. So when you're looking at claims and claims analytics, it's really difficult to say, well, what is it? Because it doesn't naturally roll up like maternity does, like fertility does, like MSK does. But when you get down to the brass tacks and you really do a detailed analysis, which Visana Health, we've now gone through 3, and it's pretty enlightening. And data's king, or maybe in the world of femtech, it's queen.
Love that. I love both of those points. I just wanted to add one quick thing too, that data is king and queen. And I think we have to start with claims data, but we all know here on this call, and I think probably preaching to a lot of the choir, to the participants, if you're choosing to join a call about women's health and the future of it, that if we're not offering really comprehensive women's healthcare that's meeting all of the various needs of the women in the workforce, it's not going to be reflected in claims today. So we do have to be creative about how we slice and dice the data, because if there is no code, or if people have to go out there and pay cash for things because there is no particular solution in their insurance network to do something, we're going to lack the data. So I think to the point of a rallying cry around how we implement and think about these solutions is, the claims data is super important, but it is only going to get us so far. So I think we're really excited about working with folks and in the industry and in the space to actually start building out more of this data to show how important it is to, when you treat your women really well and provide really excellent care, that you actually end up seeing the benefit of total healthcare cost reductions and ultimately productivity and wonderful retention there too.
Totally. And Marina, I might actually bounce this back to you, because my next question I had written down was actually exactly related to that, but to go a level deeper, kind of has to do with how exactly you work alongside or with the health plan. I think for employers, this is always one of the most top of mind, but also confusing questions about solutions that they add into their program. Is this going to be redundant to my health plan? Does it work alongside of it? Is it totally outside of it? So I'd love to hear from you, and then maybe some of the others, about how you approach that. Who is the payer? How does it connect? All of that.
Yeah, absolutely. So I can speak to the Paloma perspective. And I do think that, like I said, when you're working in a digital health solution, we have to work with the existing healthcare ecosystem, and that is the payer ultimately. So the employers working with a particular medical carrier or several of them to deliver and manage all of their healthcare spend. And so we partner closely with the payer. In fact, we work both with self-insured employers and payers, either together or independently, depending on kind of where things are from a go-to-market perspective. But when we work with an employer, we partner with their carrier. We tend to be already in an in-network provider, so that makes things easier to implement on an employer perspective. And we don't, to the point of everyone be employer benefit leaders being not having much time to manage specific individual solutions. We want it to be really simple and within the existing kind of structure of what an employer has. So if their carrier is United, Paloma Health can be implemented within the United framework. And we might have to tweak a few things to make sure people aren't hit with a lot of copays or confusion, and then communicate it appropriately. So I think working hand in hand with the payer is just a really critical piece, because people shouldn't be paying or going out and navigating their healthcare in a confusing way. We should just work with the existing system, I guess I keep saying.
Shelly, any thoughts there on how you work alongside? I know you obviously stated a lot of things related to claims and how things are, categorized and all of that. So I'd love to hear a little bit about that.
Was that for me?
Okay, yeah.
Yeah, sorry. Well, I would say that I probably am not the one that's an expert in the claims analysis for our company. I know it's a superpower for our chief medical officer and our CEO, but the data around claims is really interesting because we haven't focused on women's health for so many years. It's been a very male dominated, whether it be clinical trials or drugs around, and women are impacted differently. And so there's such a void of true data and true knowledge around what's happening. It's exciting to be on the forefront of some of this. I'm really glass half full on all aspects of let's go, let's do it now. But as Marina said, sometimes the data is just not going to be there. And a really important point around women's health is that so much of what we do is tied to our hormonal fluctuations. You go to the doctor on the first day versus the middle of your cycle versus the end of the month, and you get completely different results, different labs, how you feel is different. And the ability to have all of the various solutions that we are all focused on allow for very detailed expert time on task, when you need it, how you need it. So if for Visana, our members get access to care coaches and they can call when they're having a flare up, and they can learn how to recognize the signs and symptoms of a flare up, so that instead of going to the ER, they're recognizing in advance. If they call their physician and say, oh my gosh, I've got pain, it's coming, they say, well, we can get you in 3 weeks for Friday, or whatever that is. How helpful is that? At Visana, they can pick up and they get an appointment within hours, within days, and they can have access to a specialty trained gynecologist that day. And they can meet with a care coordinator who's taught cognitive behavioral therapy, taught how to integrate pain management techniques before they need to go to the ER. There's a massive cost reduction in being able to have real-time support. And all of us believe in the content, the community, and the care that's comprehensive and coordinated. And being able to have this iteration with your menstrual cycle that's unique to each one of us is what has been the holy grail that's been missing in women's health. We've never looked at, we didn't know to look at it, we don't have the right data, but it's coming in a tsunami, and we're all proud to be on the forefront of that.
Amazing. Alessandra, anything you want to add there about how you work with healthcare plans?
Yeah, so, I mentioned that we've been working with our first two health plan partnerships and, looking to self-funded employers as well. I think exactly what both Marina and Shelly mentioned, that direct access to a specialist who's going to give you the answer Whether that's medical or not. I know it might sound silly, but I do believe you can actually prescribe education, and the impact can be incredibly robust on the other side, right? Because if you know what's going on with your body, or if you know what to do about it or what to track, that can have huge preventative cost savings down the pike. In terms of how we've worked with, for example, Mass General Brigham Health Plan, we've partnered directly with them to market directly to their members. And first of all, I'll just say that the uptake blew them away. Anecdotally, we even got feedback that said, it's like I wished upon a star that my insurance company sent me this. I don't know anyone who has well, I shouldn't say that for any insurers on the line, but who has a really incredibly positive experience or feels really seen by their payer or by their health plan. But we were able to do that by building a solution that speaks to what has gone completely unaddressed for decades, centuries. What I think is important here, especially is, and this is not just a women's health conversation, this is just a digital health conversation, is what happens when, you have hypothyroidism and you have menopause and you have a variety of different symptoms. Ultimately, we do want to be able to help direct patients back to a provider in network or to potentially a local PCP. And so one thing that we've worked quite hard on is working with our payers as well to help build out their in-network local kind of referrals if someone does need that in-person care, and helps make that visit more effective. That's actually been one area that we've gotten a lot of feedback from our members, is that, you helped me really prepare to make best use of my relationship with my PCP, make that 7-minute visit worthwhile. So that steerage, that preparation, that education has been something that we like to report back to payers in terms of reporting and actual financial impact on the other side as well.
Sounds like a theme that it sounds, sorry, Kalina, it sounds like a theme that we're hearing is this really nice partnership with the digital health solutions and the in-network, in-person care really can set up a person or a system for a really nice, for really great success and really great care outcomes. I wanted to add on this one last point on this topic of working with payers is that no surprise to anyone, of course, each payer and each health plan payer implementation is going to have a really different flavor. And so for solutions like Paloma and others, we really do a lot of discovery with the employer and the payer on their specific instance to make sure that we can roll it out appropriately, because each one has their own. I used to work at a company that have a $5 deductible for everything. Now companies have $5 copay, I should say. Now there's large deductibles, there's HSAs, and there's complexities to how this is all delivered. So working within that is really critical too, and figuring out how a solution can be flexible to meet the needs of the individual plan designs is, I think, also another really important point.
Yeah. And Shelly, I heard you jump in real quick, but I didn't know if you're disagreeing or had something to say.
That was actually the point I was going to make.
Yeah, perfect. No, that's great. Well, I'd love to, so I know we're like 45 after the hour, so I have a couple more questions and then want to dig into any audience questions that we have. Some of these actually came in through our registration. So the first one I want to start with is related to advocacy, right? So everyone on this call, I would deem to be an advocate. You showed up, you're learning, we know this is important, but it's kind of like, how do we take that energy back and help leadership and others understand that this is a meaningful issue for the entire population? I know in my realm, sometimes this can be thought of a small segment of the company, and therefore it doesn't get the attention that something like mental health, which, quote, everyone can benefit from, does. And so I'd love to hear from you all in terms of how you can advocate for this to be an everyone issue, and how companies can really get that buy-in from leadership or finance. Yeah.
I would say we just need to keep talking, keep presenting, put the data on the table when we have it around whatever our own outcomes are, be able to show a demonstrated case that speaks to whatever the pain point of our customers are. If they're worrying about equity and inclusion, be able to talk about that with our own companies. Endometriosis impacts disproportionately a greater number of Asians. Uterine fibroids disproportionately impacts a greater number of African Americans, and the list goes on and on. As our various women's health companies can talk a lot about why should our customers care? What are their main drivers? Is it return on invested capital? Is it better outcomes and returns? Is it retention of employees or attraction? And be able to understand what their needs are and have our selling proposition be able to address each of those needs. Most of these women have multiple conditions. We can't do everything, but we can do what we're doing really, really well, which is why we all believe that comprehensive whole person coordinated care is the holy grail for what we're doing in women's health. But I'm very encouraged by the number of employers who have told me we're not pulling the trigger just yet, but we're doing a very deep dive, and the opportunity for them to listen and say, how can I be helpful? How can I help you learn more? And on the payers, I would say ditto times two. They're leaning in across multiple groups within each of the payers are looking at digital health, women's health, innovative health delivery, value care, pricing. And I'm encouraged, very encouraged.
I would follow up on that to say everything Shelly said and more. There's a lot of thought leadership happening. There's a lot of press. A lot of this and what we're talking about right now is driven by the cultural zeitgeist around a lot of these topics, right? When Michelle Obama comes out on the cover of People magazine and talks about her menopause experience, you better believe that a lot of your employees are reading that too, and they're going to feel more comfortable. Now, it sounds silly, right? Because we've been talking about claims data and deductibles, but a lot of this is what's happening, right? We're talking about endometriosis and miscarriage and you know, our mission statement is to smash the menopause taboo, which is starting to happen. And so these topics of conversation are coming out of the shadows, right? And so if you feel like you've been looking to advocate with whether it's a CFO or a C-suite member who isn't quite on board just yet, it can start with as simple as a conversation and an educational event. Now, please don't take an educational event as the Band-Aid that's going to address the solution, because it's not. But you know, we host educational sessions for we've worked with LVMH, with Reddit, with Guidewire. We've worked with financial services companies, and you can start to test the water of who's going to show up and how is it received on the other side. And you can better believe it that those events will be well attended. And we've had, you know, male colleagues show up as well, because we're not just talking about the female population. We're talking about people with partners at home who really don't understand what's going on. And so, you know, if you're starting to build the business case internally as to why this is important, start with an educational event, create a safe space to have a conversation about what's going on, and start to build that case for the following benefits here. So we have, you know, we're more than happy, and we've done many of these educational sessions to start to build that internal support.
Perfect. I think that's great. And maybe it's kind of one follow-up to that, maybe Marina, you could touch on this, or any of you really, but is, you know, like why, what we're starting to see, right, is this is becoming essentially a component of DEI in recruiting, right? So we're not thinking of this so much, like you said at the beginning, as a family forming women's issue, but really it's an essential component of retaining a core demographic of your talent. So I'd love to hear any thoughts you all have on that.
Absolutely. I mean, women's healthcare is, you know, important period, and it's an important D&I initiative. I guess full stop, in providing the best in women's health benefit is going to help your recruiting, your DEI, your folks, just your well-being of your population. I also think that there's, you know, as we touched on, there's so many issues that are perhaps unique to a group of population. In this case, we're talking about women's health that have gone unaddressed for so long. And it's now to the, if the employer is working on creating a healthy, vibrant and thriving employee community, that it's time to start addressing some of these things that have for so long not been addressed. So I just think women's healthcare flows so naturally into the D&I discussion for some of these things. And then once you start to peel back the onion, like Shelly was presenting some very specific facts around specific populations who are left out of care or disproportionately provided poor care, it just all really starts to come together as an important part of DEI as well.
Perfect. Amazing. And I guess the last question I'll ask, and then we'll take over to some of the questions we got from the audience, was anything you can share about how you think about member engagement within a population, right? So when a lot of people roll out these offerings, they may even be told, just given this is a segment of the population, sometimes that engagement might look lower than like some other benefits. But how do you show that the members are actually engaging with the population?
Yeah, I can take a quick stab, and then I'd love to hear from the others as well. One of the things that I think specialized or point solutions actually bring to the table in a really meaningful way is actually knowing how to engage really well with their particular audience. At Paloma, we measure engagement really carefully and are super proud of the fact that 52% of our members use our app at least once a day. 15% use the app at least, 15% use it once a day, 52 use it at least once a week, and 25% of our members chat with one of their care team at least once a week. So that's chatting with their doctor or chatting with their care manager and getting a portion of their healthcare navigated, and taking some of the burden off of the patient, which is, just really complex, as we all know, and adds a lot of friction to one's healthcare experience. And we really like to take that off of their plate. And ultimately, we know in healthcare, engagement is going to lead to better outcomes. So we really track these meaningful engagements. We don't just track like app downloads or non-meaningful vanity metrics, but really things that tie into one's healthcare and ultimately to their outcomes. So we've seen really good engagement. And I think in our case, it's really a population that hasn't gotten this attention for a long time. They're going to be engaged. And that's really a wonderful thing to be able to offer to your folks.
Amazing.
I think a lot of what I would say is that we start off with long appointment times in an entire team, and women often have 3.2 different conditions. They have 64% of our customers or members don't have other OBGYNs or other PCPs for whatever reason. And they get with somebody who is trained in their condition, trained to listen to them, trained in the cognitive behavioral therapy and mental health support, and they feel heard, they feel cared for, and suddenly have a plan that takes all of their unique considerations into their unique needs into consideration, and it moves the needle. You can end up with clinical care and outcomes with doctor visits or nurse practitioner visits, but also they can symptom track, and you can real time say, okay, now we're looking at what's happening for you today. You can't do this in a traditional fee-for-service environment. Nobody's paying attention in between visits. If you don't show up to your visit, nobody notices. We notice, we know, we can text back and forth, asynchronistic type of care, diet, education, nutrition, and there's the ability to follow up and check in. Now, some of our women come in with acute conditions. They want a 15-minute visit to have a birth control refill, and they don't want to have the continuity of care. But others who have chronic conditions, who have been suffering for decades, many occasions decades, can end up feeling better in 4 months' time. And that's because you have to have an iterative process to go through several cycles for the most complicated care. But we get our members, 92% of them report feeling better in less than 4 months. And that's pretty significant for women who may have been suffering for 2 decades with the same condition.
Yeah, no, that's a really great point. I would love to take, since we just have about 5 minutes trying to do time management, because I could talk about this for 3 hours. But we got a really good question, and I think this is a good one to bring to the broader group. But so thank you for your question. It was, love the focus and the value the products bring women. So thank you all for sharing. The question was, are the main target user patients not happy or lack access to their PCP and OB. So that's the first part of the question. And essentially what we're thinking about is, what is the impetus for women who are receiving the necessary care to use these projects? Is there some sort of approach over segmenting the system and adding complexity, right? So in some, like, could you talk a little bit about how, is this really a solution to just a lack of, primary care for women? Or how are you making sure you're not overcomplicating what's already maybe available through primary health insurance?
Sure. I can kick off there, and I'm sure we can probably go around in the various areas that we work in. So I will start with kind of a shocking statistic, which is that less than 20% of OBGYN residency programs offer menopause training. So the women in your network might have had a wonderful OB experience while delivering their children, if they have those. But when they start to move into that gynecological segment, or call it 40 and above, the specialists or the providers that they have a relationship with are not trained in it. What that results in is that 70% of women who actively go into their gynecology appointments for menopause specifically leave untreated or without the proper care. So we're already in the current ecosystem failing a majority of women around menopause specific treatment. The flip side of that, right? Because we would love to just make sure that all of the providers in the U.S. are as trained up as we can, but unfortunately that's not the case. How do we, at Electra, start to build out a care approach that actually meets women where they are today, and that connects them with experts? And we do that in two ways. The first one is that these menopause doulas or coaches, think of it like a care coordinator, right? Whatever the terminology might be. The function of that is to do a guide intake and to start to ask questions about what should you be tracking? How can you prepare? What is normal? It starts with education in this space, and we can prepare a woman to understand what her options might be, whether that is going back to her existing PCP or continuing on and working with an Electra provider for telemedicine care. So I think that step is what's been missing in a way. Ultimately, it does come down to the woman or the patient at the end of the day, what her approach is going to be, or how to move forward with their own care. How do you equip and arm the individual with not just a prescription, but with the education and the information to make that really informed decision? So that's our philosophy and approach. And we do that. We literally give everyone a PDF of their care plan that they can take into their existing doctor and say, this is, can you react to this, right? That's so low tech, but it's so powerful.
Oh, perfect. Totally. Speed round. I just need to add in 1 minute, each of you. Go ahead.
I'll say, if you are happy with your PCP and OB, that is amazing. God bless. And there are wonderful physicians out there. Please, we are, at least from our perspective, we're not trying to get in the middle of that, but at least in the thyroid health space, only 6% of patients are satisfied. There is a training issue. There's a structural issue around the fact that, we're incentivized on driving more patients through the system, and thyroid care patients need time. They have so many questions. They haven't been addressed. There's a lot of nonsense online that they're reading that it's hard to make sense of. So that's what we do, is we really specialize in delivering really personalized and holistic care and seeing really good outcomes there, but also partnering with the PCP and other care providers as needed, in person or otherwise, to make sure that the full spectrum of the care is taken care of. And this actually simplifies care, because when people can't get these questions answered, they're going to go and seek, 10 different specialist appointments. So we hope that this actually ends up simplifying and streamlining care rather than making it more segmented in an interesting way.
Yeah. And Shelly, any last comments?
Last comment is that we're not looking to take patients from someone else, but so often the women that we treat require so much more than they have time for, that they welcome the partnership. So it's so far, touch wood, it's actually been a more streamlined partnership than one would expect. We're not looking to cannibalize their patients. We actually usually end up being a better referral for them, a vetted referral. Yeah.
Amazing. Well, we are at time. Thank you all so much for participating, at least on the panelist side, and Randi for organizing, and obviously all the questions and participants. I know that Marina, Shelly, Alessandra welcome you to connect with them and ask any additional questions about their products or their knowledge on this, or help with advocacy or anything like that. I also am happy to be a resource myself, but thank you everyone for joining. Yeah, would love to continue talking about this. So hopefully we'll gather again.
Thank you so much. Thanks, everyone.